Welcome to the Commonwealth Club of California and our special program tonight, Trans Month Talks, Trans Wellness, Equity, and Health, brought to you in partnership with San Francisco's Office of Transgender Initiatives. Our thanks go to all of the organizations and leaders participating tonight, and you'll meet them all in just a moment. I'm John Zipperer, the club's Vice President of Media and Editorial. We hope you are staying safe and are well wherever you are. And we look forward to seeing you in person again someday in the future at the Commonwealth Club's headquarters in San Francisco. Our program today is made up of two panel discussions. The first will be moderated by Claire Farley, Director of the Office of Transgender Initiatives, and the second will be moderated by Michelle Miao, host of The Michelle Miao Show and a member of the Commonwealth Club's Board of Governors.
Thank you so much, John. It's an honor to be with you all. And thank you so much to the Commonwealth team for partnering with us and making this special event happen. I also want to thank all of you for joining us tonight for this special Trans Month of Awareness discussion. I also want to give a special shout out to all of our community partners who helped make this special night happen. Tonight, we have an incredible lineup of speakers to discuss the future of trans rights and a special panel conversation on trans wellness, health, equity, and COVID. Earlier this month, we had partnered with the San Francisco Trans Film Festival, and we want to send a special shout out to Shauna Varaga and her team for their continued support in supporting trans filmmakers and artists. Across the country, our trans communities and allies are recognizing this week as Trans Awareness Week. Although in San Francisco, we like to go big. In 2018, we joined Mayor London Breed in expanding the week and declaring November Trans Awareness Month in San Francisco. This tradition has continued in our annual flag raising, and on Monday, we raised the trans flag over City Hall, and it will remain up throughout the week as a symbol of the city's ongoing commitment to trans equality for all. Also, there is some additional programming throughout the rest of the month that we want to make sure that you're aware of. Please check out our calendar linked in the chat. We also want to highlight that on Friday, November 20th, San Francisco will be honoring a virtual Trans Day of Remembrance event. We want to send a special thanks to Nikki Kalma and the entire TDR Planning Committee for making that event happen. Transgender Day of Remembrance was founded 21 years ago by Gwendolyn Ann Smith and is now recognized around the world. This event brings visibility to the lives lost due to anti-trans violence. This year, we've passed a grim milestone, with 34 trans lives lost to fatal violence that has disproportionately impacted Black trans women and women of color. We hope you will join us for this ceremony on Friday and honor those lives. Although this month has looked different due to the ongoing pandemic, we have still come together virtually to celebrate one another, honor our history, our resilience, and our strength against all odds. It's now my honor to share a special message from Mayor London Breed in honor of the month. Let's check it out.
Hi, I'm Mayor London Breed. Thank you to Claire Farley and the Office of Transgender Initiatives for making sure that despite the challenges we face due to COVID-19, we are still recognizing and honoring Transgender Awareness Month through our traditional flag-raising ceremony. This year's ceremony may look a little different, but our mission to end discrimination and violence against transgender and gender nonconforming people remain the same. In fact, these past few months have shown us how critical it is that we continue this very important work, fighting for strong legal protections, keeping people housed, safe, and healthy, especially during this public health crisis, and supporting critical community efforts that are led by and for our trans and gender nonconforming communities. Yet despite the many obstacles, this community has also shown incredible resilience and strength. During this month, we remember the leaders and historic moments that have shaped the trans movement in San Francisco and across the country, from the Compton's cafeteria riots and our roots as the first city in the country to honor Transgender Day of Remembrance, to today, where San Francisco is home to the first Office of Transgender Initiatives in the nation. Despite our progress and commitment to equality, our work will not be done until there is not one more death in this country due to violence against transgender and gender nonconforming people. But this month is a time to reflect on the progress that we have made here in San Francisco. I am proud to be mayor of a city that is a beacon of hope for those who seek true equality, tolerance, and inclusion. Thank you for joining us today to celebrate and honor Transgender Awareness Month in San Francisco.
Thank you for your ongoing support of the community. Despite the ongoing pandemic, Mayor Breed has committed to invest in our essential services and community. In October, we announced an ongoing commitment of over $5 million annually to support our vital trans programs and services, from housing to employment, wellness and mental health, professional development, and violence prevention services. We will hear from many of these organizations tonight who are supporting our community every single day. Now it's my honor to invite our panel in. The COVID impact has had an incredible impact on our daily lives in our communities, from unemployment, businesses closing, huge health disparities across our communities of color, and the ongoing impact of the pandemic on our health and wellness. And this continues to grow. Although we have also seen so many moments of resiliency and support of our communities where people have dedicated their lives to service during what they can do to give back, from our healthcare workers to our first responders, community organizations, and those on the front lines. So many residents have stepped up to assure that we're keeping each other safe by staying home, social distancing when we're out, and wearing masks. We honor those who are checking in on their neighbors and working with everyone to support supplies and needs, from delivering groceries to our seniors, emergency housing support, mutual aid fund efforts. The community has really stepped up during this challenging time, and we need to keep doing that work. Now I'm honored to welcome our dynamic panel of community leaders working on the front lines to advance trans wellness, health equity in the time of COVID and beyond. First up is Akira Jackson, Executive Director of Taja's Coalition, Nicole Santamaria of Ella Para Trans Latina, Jenna Rapuez, Program Director of Gender Health SF, and Shannon Amitten, trans activist and co-founder of San Francisco Bay Area Queer Nightlife, and Anjali Rimi Koka, President of Paravar Bay Area. Thank you all for joining me. Now, Nicole, first question to you. As you know, we are seeing a rise again in the Bay Area and across the country of COVID cases. We also know that communities of color, specifically Black and Latinx communities, are disproportionately impacted by the virus. How are you seeing this impact members of Ella Para Trans Latina, and how are you addressing this need in the community?
Well, thank you so much, Claire. Thank you, everybody, to be here and for sharing this space. At Ella Para Trans Latina, when the shelter-in-place ordinance started, we worked immediately to change our program. So our program was the first program, a LGBTQI plus program that will directly online. So we created a hybrid program, and we never stop. We never close our ongoing support to our communities. So that was possible as well in these very challenging times, to create strategies to bring the resources to our communities. And how we did that, it was through community. So one of the things that I found in this pandemic, it is that here in the gender diverse, trans, queer communities of color, in particular Black and Brown communities, we have to look for each other, and we have been doing that. So I'm pretty grateful with all the efforts that we have been done together. We implement an LGBTQI plus COVID relief coalition. And I had the opportunity to meet, for example, wonderful partners that I didn't have in the past. For example, Parivar with Anjali Rimi. We have been working for a long time ago with our sisters as Taja's Coalition, our sister with TGIJP, our Black trans sisters that have been also impacted, not only with the COVID pandemic, also with the pandemic of hatred that our communities are in right now. And as a proof are the increase of cases of murders against trans women, Black and brown, mostly during this year. So both pandemics for our communities are very, very harsh on us. So, for example, we had the opportunity to work and partner with TAJAS and OTI to bring people to be housed, because in our communities, chronic homelessness, it is a reality. So how we can navigate those needs and and how we bring the resources to our community within the community. So sadly, at our program, we have 2 losses in this period of pandemic. And one of them was very early during the pandemic, and it was us. At the end of the day, was her trans sisters, in particular trans Latinas, in particular Ela para Trans Latina, in particular myself, the one who was looking for her until we found her. So, and that's the meaning of the teamwork in this very difficult time. So we have been continue working together and created in community strategies to continue working. And we are also strengthening the support that we have already done since many years ago. So Ela para Trans Latina, as Ela, has 14 years working. But before that, we have 26 years working for our trans Latinx community. And we are planning to continue doing that work with the support among us and also the city support.
Thanks so much, Nicole. And I know that you're doing also incredible work with mutual aid efforts. Community can come by and get gift cards and resources. And we've partnered together on referrals to the shelter-in-place hotels. So thank you so much for all the work you're doing. And we'll add those resources in the chat. Next, Akira, Tasha's Coalition works to address violence against trans people of color, as well as overall systemic injustices and inequalities. How are you seeing the pandemic impacting trans communities and intensifying these inequalities for trans folks of color? And what are some of the solutions that you and the Tasha Coalition effort are using to address this?
Thank you, Claire. So housing continues to be the biggest issue with in our community. The coalition has identified that there is a lack of understanding in accessing housing services. We continue to be creative in addressing emergency housing. Over these months, we've had so many different community leaders and just people who just had a lot of concern about our people staying housed or actually getting housing with the fires that was happening and just a lot of things that were happening around in the Bay Area. It was beautiful to see folk come into action to just create these models that were short term. And it allowed a lot of our participants to be able to think more. It allowed our participants as well as the community leaders to think about more of a longer term strategy. The coalition is continue to work closely with the Office of Trans Initiatives, the San Francisco LGBT Center, Ella, Lyon Martin, and St. James Infirmary to place unhoused transgender people into short-term housing. This issue has been addressed. So right now we have a TGNC subsidy task force. And this is really, it's a new project. We've been working with it for the last few months. The TGNC task force is comprised of community experts, so those that have the lived experience, as well as those who have some more access on the housing sectors, whether if it's property managers or landlords, and just people who have concern around housing and expertise. And this is a pretty interesting model. So it's like a surveillance and monitoring model. That also provides technical assistance to programs that are providing similar services that are transgender and gender nonconforming, welcoming, and inclusive housing structure. So I'm actually really excited about that. Some of the folk are on the call right now, and it's just really good to see folk, and we're still smiling and we're still pushing forward through this. Taja's, we continue to keep staying focused on service linkage. The trans community continues to need support with attaining gender affirming documents. So in mobile devices that allow them to participate in remote services and financial planning workshops. So it's just basically the same things that what we've always have had in the forefront. Like literally we've been marginalized. We just haven't been at the table. We haven't been included. And in this, pandemic, what happens is that we're further pushed back into those margins and further not seen. So the beautiful thing about this is that our community leaders, as well as our city officials, are just stepping up to just make the call, to answer the call and continue on with their pledges. And I think I'm looking for a really good year. So thank you
so much, Akira. And I know that your work through Trans Home and your leadership there has been so instrumental in having that program launch, serving over 100 people a year. 87 people on ongoing or emergency subsidies. And this time is so important. So thank you for your work. And we're getting a lot of good questions in the chat around housing. So we'll come back to that. But first up, Anjali, can you talk us a little bit about how Parivar Bay Area has partnered with the Bay Area trans and LGBT community to organize and mobilize around the pandemic? And how did this start? And what are some of the essential things or resources that community is asking for?
Thank you, Claire. Beautiful to see you all here. I think as we all heard, trans folks are always pushed to the margins, and in a pandemic, it's only furthered. And so this came about with a simple phone call, but more importantly, a grassroots attempt for us to build bottom up in a very, very strategic way now to pull all the resources together. And we needed to do that because the strength is in all of us coming together rather than trying to find a way to sustain and survive during this pandemic. So Parivar, with the support of the Office of Transgender Initiatives, kicked off a coalition for being how green we are. We are 2 years into existing. We are a South Asian transgender non-conforming centered South Asian organization. And we really had a vision to pull together the strengths, the resources, the beautiful hearts, and the leadership in the Bay Area so we could support all of our community. And if there's one community that can get through tough times, it's this community, the LGBTQ community. So this was a beautiful example of community coming together during the crisis. And, it was important for us to hear each other out rather than be continuously within our home communities and continue to serve them, because we were all doing the same effort. And rather than duplicate it, we could scale it, we could come together and do something different. And that's exactly what transpired. We went out into the community with great transparency and accessibility with the website and asked the community what their needs were. And the most important need for folks was to pay their rents, keep a roof over their head, followed by needing support for essentials, food, basic food. And then the third support they needed was to be able to get prescriptions and medical attention for essentials that they needed to survive. So the needs were paramount, but our effort was kind of building up. So we tried our best to come up with strategies that worked for this model. In total, we gave out $132,000, or I should say we raised $132,000, including $75,000 from the city of San Francisco, which we're very grateful for. We have given out about $60,000 and supported over 300 folks. And 56% of those folks were trans, Black, Brown, Latinx, people of color. So, there's always this kind of missing piece in the nonprofit world where we don't have enough data, which was one of our strategies, to have a data-driven decision-making to make sure our disbursement was prioritizing people at intersections that were further marginalized. Another strategy that worked for us was to build a model of gathered funds and resources with community input. And as we are continuing to go through this and open up our second round of financial relief, we are learning. We're learning to scale our strengths and remain accessible to the community. We are learning to be open to adapting to different ways of community needs that are emerging, and want to build this model out for sustainability, because there was a silver lining in all of this, that we realized that we could exist together and we'll be so much more powerful bargaining for the common good of many more in our community. So, I'm very grateful for Claire and all the community leaders that trusted and came together and helped support a lot more lives than we could have with this coalition.
Thank you so much. And so many of those coalition partners are on this chat tonight. And we'll hear from more of them later in the program. And also we'll add the SF Bay Area COVID Coalition website in the chat as well. So next I want to turn it over to Shannon. You're busy with so many different things, but somehow found the time to co-found the Queer Nightlife Fund. Can you tell us a little bit about this work and what inspired it, and some of the resources that you're sharing with the community?
Absolutely. It is an absolute honor to be here with all of you. This Zoom room is full of all of my favorite community leaders. Thank you for the work that you do. The Queer Nightlife Fund came out of the immediate realization that folks that rely on nightlife for their livelihood were going to be very quickly without an income. Initially, when it was created, we thought, this would be a month or 2 months or maybe 3 months. But for queer folks that work in nightlife, you're often paid cash. And so we knew that unemployment wasn't going to be an option. So, we have go-go dancers, party promoters, all kinds of dancers. I shouldn't limit it to go-go. So DJs, and this was a community that has always been really welcoming in terms of it's been a safe place for trans folks to express themselves freely. So we quickly came together, and through community-based fundraising, we were able to provide raise $266,000 and give that out to over 300 folks. We also launched a Queer Nightlife Talk program. So we discuss of the moment topics like mental health for folks that are used to going out and getting lots of social time. It has been a really challenging period of shelter in place. And we've also imagined a more inclusive nightlife, because nightlife, while it can be a safe place to express yourself, it is often ripe with misogyny and white supremacy. And so we're really looking at how to reimagine a better nightlife when we open. We've also partnered with the Entertainment Commission to advocate. And again, nightlife there's no union for nightlife. There's nobody really organized and looking out for each other. So we've realized that there's a need beyond just this moment. And so we also have made it a part of our mission statement to prioritize women, transgender, non-binary, and all Black, Indigenous, and people of color in our work. That is something that's very necessary in this moment as we reimagine a better future. That's a little bit about what we do.
Thanks so much, Shannon. Really well said. And make sure you check out the Queer Nightlife Fund. We have that in the chat. Next but not least, Jenna Rapwez, Department of Public Health, would love to just hear more from you around Gender Health SF and how you're seeing, both in the research work that you've done for so many years, what are some of the health inequities that we see that are emerging from COVID, but that are compounded more broadly and specifically impacting communities of color?
Yes, thank you so much for having me. It's a great pleasure to be in company with really fabulous community leaders. First and foremost, I mean, I think it's really important to really think that without a doubt there is just really rich data and research around the experiences of trans folks, around health disparities, stigma, discrimination, and lack of access to quality care. And and I think that has grown from HIV research and community organizing, since for a while there was a lot of invisibility and exclusion of trans folks in that data. And so there are, it's through kind of community organizing and community visibility that, really grew rich with the data that we currently have around health disparities for trans folks. I also just want to really point out, I think, it's really poignant to point out that in the past year or the past couple of years, most recent years, the current climate that we all kind of have been navigating really does speak to that inequity and systemic institutionalized transphobia that exists in our current society around exclusion and denial of trans folks and equitable access to healthcare. So that's just really important to really frame and understand. I mean, when you think about what has been messaged from the federal government and around potential loss of access to equitable healthcare and protections of these services, there is a lot of anxiety and fear and worry around potential loss of that and what that really means. And so I just think that besides the compounding experiences of navigating COVID, on top of potential loss of these benefits that are afforded to us, I think that the reality of just having to really navigate that and fear and accept that is really real for many of our communities. A couple of things that we think about when we Gender Health SF specifically, Gender Health SF was born out of community advocacy and community partnerships who advocated for a program such as ours, because we know that in community, access to surgeries and gender affirming care improves quality of life. It increases engagement with your primary care providers, mental health providers. It does really make a big impact overall. For us at Gender Health SF, we work with folks who have never imagined having access to these services, who never even imagined being able to get surgeries, and never imagined being able to get quality care given kind of the historic discrimination and marginalizations of our community. And so the way we really think about Gender Health SF is really being intentional of how we approach our model. And kind of really, the other things I just wanted to add about Gender Health SF is that we are the first of its kind in a public health system to be created to respond and serve to our most under-resourced and poor trans folks who are navigating lives. And so I think, the way we think about how we model that is really ensuring that we support patients in having education, making really good decisions around their health and access to care, enforcing informed consent. Other things that we really implement that has been really helpful for us is that because we are peer-led and peer-driven, with peer navigators supporting patients to advocate and to really make these informed decisions, it really does make a big impact in overall outcomes. It's not just about access, right? It's about the quality of care that you get in a healthcare setting and the treatment that you get from providers. And so I think that model that we've implemented at Gender Health SF has actually been really crucial in being able to support our patients to have really good health outcomes and have really good quality of life. One thing that is unique to us, I think, a couple of things, right? Two other things I wanted to add that is unique to Gender Health SF is it's not just about surgery, it's also about wellness and preparing folks to be able to have really good outcomes. And because, our experience around health is not just singular, it's multiple things, right? That we're navigating social injustices, discrimination, transphobia, housing, employment. And so I think we really implement and really look at patients as a whole, as opposed to just a person who's, trying to access surgery. And so we really truly try to respond to that as best as we can and really implement a whole person care model and approach to supporting our patients. Lastly, I think that was really important too is just wellness and this notion of peer development and workforce development. I think, uniquely to our program is that we are able to implement peers to support them in their professional development and, really gain skills so they can, gain skills that they can actually, would be able to use to further their career in gender health.
Thanks so much, Jenna. And we're getting some really good questions in the chat. And this first one is about healthcare. And, I'll throw this to Jenna and then to the group if you'd like to add. But it says, with the change in the presidential administration, which I know is a blessing and still in process, but we're on that path. As well as with the new SCOTUS judge. How do you see Obamacare? Is it safe, and will it continue to be restricted? And what does that mean for trans folks? Jenna, do you want to speak to this?
Yeah, I mean, that's a really great question. I mean, I think there are still unknowns around kind of what the future may hold around Obamacare or Affordable Care Act. I mean, as we speak, there are some movements to take that away potentially, and just this looming fear of what that may look like. But I think, I go back into my work and experience in public health for about 20 years. I've gone through the Bush administration. I've gone through many other things that has happened in our community. And I think one thing remains true is that, our community is strong and resilient, right? We're actually, up for a fight, whether or not some of these protections may be taken away or maybe repealed back. I think that is the moment that we have now, and the power that we have actually in our organizing skills to be able to work towards, some of these things that are currently under attack. And so I think I am hopeful, and I try to remind folks is that, I think despite this kind of looming fear that these protections may be taken away, I think there are strategies and there are folks who are really, leading and spearheading some of these issues so that they don't necessarily get taken away from our community, and that these protections are preserved for our community.
Yeah, thank you so much. And that reminds me too of something you said earlier, just around the last 4 years and the administration, and really seeing the impact of the attack on housing and healthcare access, and so really looking at what the future can be in overturning a lot of those discriminatory rules. Another question that we have in from the chat, I'll send over to Akira first. Transgender people are at risk of eviction, and with the eviction moratoriums expiring soon, we don't have a date on that for sure, but they've been extended more than once. What can be done about that, and what are some of the strategies that Taja Coalition and Trans Home are using to address emergency housing needs?
Yeah, good question. So at this point, we've actually preparing for the rainy day fund thing with the project. So Taja's is responsible in addressing this as many as long as so basically we have enough. We kind of, I don't want to jinx it or anything like that, but we're working on ways on making sure that those are up for eviction or any types of crises that we can respond into it, and it's a little bit more promising. I'm kind of excited about it, but like I said, I don't want to jinx it, but just as the same with our trans home. Our trans home is, have been faced with so many different types of issues, even from out of San Francisco and literally nationwide. I get so many emails and phone calls, and as well as the rest of the team around being put out of their homes just because they're coming out as and identifying as trans into their communities and their families, and that's a form of crisis. And oftentimes, sometimes, especially with this pandemic, the eviction could possibly happen based on the fact that they're not having enough funds. And that's something that we have been seeing arise, is that, people aren't able to continue to keep paying for their rent because they're out of work. And unemployment services, as what you mentioned earlier, Shannon, that, for those that were entertainers or workers in the nightlife, or even service industry workers who often sometimes don't have proper documentations, and they're just surviving. They don't have that type of income. So this is something that we've been planning for months, and we've actually been seeing it trickle down to actually multiplying as the months to come. But we're definitely pulling together with the TGNC task force and working with the office, continue to keep working with the Office of Trans Initiative and the Our Trans Home SF project to make sure that there is some type of safety net.
Thank you so much. And Nicole and Remy, can you both maybe speak to this next question? Someone's asking, San Francisco is such a leader in recognizing the need of trans folks. What can we do to help support other cities and other communities? I know you both do a lot of work internationally as well, to help share what we've learned here in the Bay Area. Nicole, first to you. Big question.
Yeah, it is a very good question. Good question, and also very tough, because as an immigrant, as an indigenous, intersexual, transsexual woman of color here in this nation, and having all the different factors that are involved in for example, in this kind of situations of gender diverse and trans queer people. I think that one of the best things that I always found out, it is based in the work, in community work. So one of the things that I will recommend or I will suggest to the rest, because as Akira has mentioned, when our programs became online or open our doors online, that was the opportunity to have participants nationwide and even outside of US. So we have been hearing different challenges around nationwide and also outside of the US. So one of the things it is like create safety plans, create networks that you can trust, and our communities can provide those safety networks, and trying to come together with a solid plans together to also make the governments, to make the majors, to make the politicians accountable for their policies and their decisions. So because we are also navigating the margins, the discrimination that is still persist in our institutions here. So when we are struggling to survive and thrive and flourish in a world that is against trans and gender diverse people, we need to have our backs. So working in, for example, for me, this administration that is leaving, this past administration, has been like working as a therapist before, like living an abusive relationship, and as an abusive relationship, you need to have a safety plan always, how to get out of these situations with the self-determination, investing and believing in our communities, believing them in the so-called minorities, because when we are using that word in our communities, coming from cis people, it is also a tool against us because they are taking away our power from us. So with that sense, it is coming together to make visible our capacities, our strengths, our gifts that we have to offer in order to create the responses that we need to see happen for safer communities, where the human rights are granted, not only in paper, but also in the practice, So I will suggest that. And Remy.
So beautifully said, Nicole. I think in the Bay Area, we definitely live in a safe haven. And I can say that as an immigrant, as someone who's lived in the South and many countries. But I think the best thing to do is to help people elsewhere who do not have the same sense of security to build sustainable models of equity, economic justice. And that's what, Parivar has done through this COVID, is support 3 organizations back in India and be able to give them some sort of a building capability, some sort of a way to have access, some sort of a way to have awareness that they're not only relegated to doing sex work and begging, which kind of is at standstill when the whole country goes into a lockdown. But right here in this country, through this coalition, the LGBT plus COVID Relief Coalition, the word got out, and we got requests. I personally got phone calls from our Latinx trans folks all the way down in Rio Grande Valley in southern Texas and Mexico. And it's about making sure that we are able to carve out resources for them, connect them with their local resources. And finally, I would say it is about sharing our best practices. We are all learning in this together, and we are all struggling. But in a way, the world is boundaryless now. We can all be there for one another. And that's what we have seen work well, is to bring those folks into support groups, bring those folks into events, so they know that they have a community that they can see, talk, and is there to support them, even though they don't feel safe going out of their homes, out their doors, just because of the prevailing laws or the community stigma and such.
Thanks so much. And I know that many of you also participated with our Trans Advisory Committee Advocacy Day. And to Nicole's point, letting elected officials know the impact and the need for resources during COVID and beyond is so important. I want to come back to wellness and mental health in a moment, but we have another question from Facebook that I'm hoping Shannon you could speak to, as well as Akira. How can employers create a more welcoming environment for trans community? And what are some of the healthcare benefits and things that folks can add to create a stronger culture of inclusion?
Do you want me to go first?
Sure, yeah.
Sure, okay. Well, hiring trans leaders is a really, really great place to start. If it's all white and cis at the top, then you're gonna really struggle with creating an inclusive environment. So that's always my first advice. And as for healthcare, I'm gonna defer on that one.
Yeah, definitely. Well, Akira, do you want to speak to this a little bit?
I honestly, I kind of want to definitely echo what Shannon said. Working in so many different types of capacities. Oftentimes, like what you mentioned at the top, it's just not the communities that there's no representation of us, and therefore, people are circumventing the system or not having any types of lived experience to make sure that these services are more inclusive, and also welcoming and culturally sensitive and understanding. So without even just using the word culturally sensitive, people need the lived experience to actually provide adequate services to the communities, especially in healthcare capacities. There's been times where I have, been in positions where it wasn't the most welcoming. And me being who I am, of course, I had, advocated on my own behalf, because I'm thinking okay, well, this is happening to me, and I'm quite sure something else has happened to other people who may not have the voice, or may not feel like that they have the time to sit there and address these issues to people that we trust, and they make a lot of money to serve us. So, yeah.
Mm-hmm.
So
yeah, that's such a great point. really thinking about how do we not only hire trans folks, but once we're in those workplaces, how are we respected? How are pronouns used correctly? How do we have access to, basic transition care? Jenna, being our health expert, do you want to talk a little bit about, obviously California mandates, trans inclusion across benefits, but what are some of the things that you would recommend to employers or allies that want to champion trans healthcare rights within their workplace?
Right. Thank you. I think a couple of things. I mean, just echoing what Akira and Shannon was saying earlier, which is hiring trans folks, really believing in their professional development, implementing some workplace practices that are inclusive and safe for trans folks to work in and also thrive. I think for us, what I think about often, even in my lens, and even in San Francisco, that there is constant discrimination and transphobia that happens in the healthcare setting. Even in San Francisco, I can see that. I've seen it in my role, and so I think there is a lack of capacity and bias, microaggressions that happen with healthcare providers, and the need for more increased training. I mean, I think in the past decade, we've done a lot of 101s in really providing safe, affirming care or safe, affirming spaces for trans folks. But we need to do a 102 and a 103 to continue to provide our providers on the evolving nature of gender identity and the kind of the binary, but the spectrum that exists within our community. And I think those are the things that are still lacking. There also just needs to be institutional commitment to address transphobia and systems of oppression that we all know exist and is prevalent in many of our healthcare settings and institutions that sometimes that exist are not necessarily addressed. And so those are the things that are really important to shift the way in which we think about systems of care and think about shifting access to care, because it's not just about access, right? It's about the quality of care that we get. It's about really being respected and really being honored and really being a partner in our healthcare decision-making processes to ensure that we get the level of equity and respect that we deserve as trans folks.
Yes, equity. Thank you so much for bringing that up. Anjali, do you want to also add to this?
Absolutely. I come with a different perspective of having worked in for-profit for almost 20 years. I would say everything mentioned is so true and needs to happen. But ultimately, it comes down to any company, for-profit or any organization, nonprofit, needs to really build and foster a culture of inclusion that's just not plastered up on a wall, but actually is seen in every single associate that walks through that door. It comes down to building capability to look at trans, gender non-conforming, diverse folks to be very well qualified associates and not allow their identity cloud over their competency and hence stunted in their growth or not even be employed. And the third thing is around capability. It's about organizations taking on things that are more tangible, such as really offering true trans inclusive health benefits rather than having a roster and a calendar of doing trans events throughout the year. That's probably more diversity tokenizing, but make it more sustainable. That's going to impact individual lives. And as mentioned, I think it ultimately comes down to recognizing their own privilege and their own bias and working past that and allowing a trans person or anybody who's on the margins to be able to bring their full self to work.
Thank you. Yeah. So it sounds like I'm hearing education and awareness, but also what are the tangible steps and ways that, allies can, support in all gender restrooms and pronoun usage and benefits, and that it's not just the trans employee that's doing all that work. We have a lot of questions, but not a whole lot of time. I want to make sure that we have a chance to hear from all of you around trans wellness and mental health. I know for myself, this period of COVID and as we talked about, the last 4 years has been really challenging. What are some of the ways that you're seeing this be impacted within your work, and how are you all taking care of yourself during this time? And I know Nicole's a mental health professional, so I think I'll turn it over to her first, and then we can just hear from everybody.
Okay, I think that personally, in the program, I've been seeing in my staff and also our participants, we are all immigrants. So in Latinx culture, the sense of community, the sense of family is so rooted. So quarantine and, isolation can be very rough for everybody or for each one of us. But it is kind of implementing the grounding techniques about breathing, how for me it is important to recognize and have the awareness that breathing is the sense that it is this virus is taken away from people. So when many people are struggling to breathe in different senses with the virus directly in their lungs, in their bodies, but also how to breathe with economy, with the health care, with the employment, et cetera, it is to give it a pause and make sure that even that we are apart physically, we are not really separate, because solitude, it is not the same to be alone. So it is the kind reminder to everybody that we are not alone. We are here, that this is a struggle and this is a test for every one of us. But at the program at ELA and for myself, I know that I'm accompanied, even that there is a safety distance between us, but it is not a distance from our hearts and our well-being and thoughts. And I go gardening, I breathe, I go to my pets. So I always suggest to people to go back to their roots, go back what made them feel complete, how made them feel happy, with what brings you joy, and or looking for what is the place that you find peace. So when you find that, go to that place that you are that you found joy, that you found peace, and stay there and embrace it. Thank you.
Thank you. Beautiful. Najali, do you want to go next? And then we'll just hear from everybody.
Sure. I think these are tough times and none of us predicted it. But I would say focus on perspective. When we got into shelter in place in May, we never thought we would be here in November. So we kind of kept on hanging on to hope, as we got these updates and things got worse and the lockdowns got extended. But that's the perspective to keep, because, and for me personally, that is much better than having both my parents get COVID and have to quarantine and try not to get COVID in my home. And so the perspective completely changes. So I'm not saying it could be far worse for you, because that's truly not a healthy way to draw a comparative, but it's to keep that perspective that these are times that we could write about one day, that our generation went through, and our trans resilience is what got us through as a community together. I'm sounding very utopian. Trust me, there are times when I'm very depressed because we are already so isolated. And when we don't see people, we get even more isolated. So I have become a little butterfly in social connections, in trying to find ways to connect and picking up the phone and calling people rather than text. And those are things that really keep me going. And also sticking to my routine, dressing up and preparing for this panel as though I was actually going to Commonwealth Club. That kind of keeps you going, because that's how human mind functions.
I love that so much. And I know I was thinking about that today. I'm like, this is the first time I've had to wear dress clothes in, I think, a couple of weeks. So it's a good alternative. So many good tips. Jenna?
Yeah, I mean, I think just, I do want to recognize what folks are also saying is that it's been a difficult year, and it's a shift of different things. And I think as community leaders, I think we all hold that weight of the experience of global trauma that many of our community members and many folks around us are experiencing. And so, sometimes you're going to have to step back a little bit and and understand and recognize that, you have to give yourself self-compassion a little bit. You have to slow down, ground yourself. I think in my work and also in my personal life, I've adapted a culture of wellness and mindfulness where I do breathing exercises, which has been really great. I'm not the best. I'm also learning because, truth be told, it's an anxious, crazy time. But I think that the more that we just open ourselves up to this idea of grounding or developing a practice where you follow your breathing, the slowing down actually is helpful because it does remind us of the breath and it does remind us of who we are and and our purpose of being here. And so that, and also just staying connected with community. I value a small group of community trans folks that I really value and cherish, and that has been actually been helpful for me to sustain this crazy times.
Thank you so much. And that reminds me too of just the importance of chosen family, especially with the holidays. We may not be able to visit friends or family, but just really having that connection of sisters and friends in our community. Shannon, what are some of the strategies? You do so much. How are you taking care of you while you do all those other amazing things?
Well, I'm lucky to love what I do, so that makes it easy. But I would say one of the things that has been the shining moment of this pandemic has been watching people come together. And I love that as queer folks, we always figure out how to party. So whether that's our, the Queer Nightlife Fund, we do lots of emails and meetings, but then we get to throw a monthly event called Quarantine, and it allows us to partner with lots of different amazing DJs and performers and hosts. And it's something that I really look forward to. And we have a Zoom room as well. And so you can dance in your living room and we'll put you on a kiss cam, and just seeing each other living our lives to the best of our ability is sort of us. Watching us make it work is it's what gets me through right now.
Yeah, I love that so much. I feel like I need to do more dancing in my living room to Lady Gaga or something. Yes, please.
I'll invite you.
Akira, would love to hear from you. I know that you're doing so much work as well. How are you taking care of yourself, and what are some wellness strategies that you use or that you aspire to, that we're all aspiring to?
Well, I say for months, I've been like very under the work and in the work. And just as of like a few months ago, like maybe 2 or 3 months ago, I had like, a moment to where I was just like, what is going on? Like, I honestly can't see anything out in the world except for what's coming through emails and what's, folks' trauma. And it definitely does impact me. But then I honestly I had to stop and just think about all the work that we put in. I had to think about all the work that we put in. We put in so much work, and we're here at this point, and we got some more work to do. And just to get me to that, like the bridge, like to cross the bridge, I call people. I call people when I'm having some trouble and just like, I need some support. And it's fine. I do need support. I do talk to folk and I do get the support, and we can share, we bounce off each other, and we keep each other strong. And I think that is why we're at this point, and that I'm truly, truly, I trust that we can continue to keep going through it and just make it out of all of this stuff for the generations. So,
yes.
Yeah.
Thank you so much. And I know I've been on many of those calls, venting, talking, so appreciate your friendship. And I think, as we come to almost to the close of the program, there's so many just insightful things shared, from taking care of ourselves to, staying connected virtually, grounding, breathing. Obviously in this moment, we're coming into a the largest uptick in COVID. And it's, really seriously, I think it can get easy to have fatigue with COVID. But now more than ever, we need to stay safe, wear our mask, social distance, and just really take care of one another and each other. So in closing, I would love just for folks to share one or two words of just something that gives you hope for the future and where we're going as a community from here, both taking care of ourselves and each other. Jenna?
Sure. Listen to public health leaders and wear a mask is my advice.
Thank you. Shannon?
Pride just announced their theme for next year, which is all in this together. And I think that's the focal point right now. It's just remembering we're in it together.
Kira?
Power building. We talk about the coronavirus, but there's definitely a pandemic of anti-Blackness that's just persisted in this country and this world. So definitely power building.
Thank you. Remy?
Al Steel Turnout, who's been a great coalition partner and supported a lot of folks' mission, which is strengthen our community through connections.
Thank you. Nicole?
Well, for me, that brings me hope that nothing is forever. So,
Can you say that again? We lost the first part.
yeah, for me, it is like the reminder that nothing lasts forever, that everything passed, and this struggle, these challenges also will pass, and in community.
Beautiful. Well, thank you all so much for joining us. And I really appreciate just all of the wisdom and just so much openness and vulnerability in sharing both yourselves and your work, as well as the work that we have ahead. And I know that we can do it together. And just so grateful to have shared this space with you all. So thank you. And now it's my honor to turn it over to our next panel, The Future of Trans Rights, with our host, Michelle Meow from The Michelle Meow Show. Thank you so much.
We're now in part B of our program tonight, in which our discussion will focus on trans policy from the local to the national level. I'm Michelle Meow, and I'll serve as your moderator tonight. Our movement has been through a roller coaster of progress over the last decade and into the 2020s. On a federal level, trans rights went from incredible forward momentum to securing one trans victory after the next, and that momentum came to a screeching halt with the current administration, or feels like it at least. Instead of making federal advances, the transgender nonconforming communities have now had to fend off what felt like weekly attacks on the community. Even though we played political defense on the federal level, our community has persevered and have still made incredible gains, such as the SCOTUS decision on employment discrimination and attaining critical local programs. Give the new makeup of the Supreme Court, a new administration, and a strengthened local grassroots transgender nonconforming movement, what does our future hold for us? What are federal and legal gains to be made? What are our opportunities on the state level? And how does the work we do on the local level impact our community, both in policy and in the flesh? Our panel of experts will answer all those questions for us, I'm sure. I'd like to introduce you now to our panel. We have Sasha Bookert, who's the senior staff attorney over at Lambda Legal. We have Nikki Kalma, otherwise known as Tita Ida, a social activist and also the director of programs and community engagement at the San Francisco Community Health Center. We have Maceo Person, director of communications and external affairs at the Office of Transgender Initiatives, also board member of San Francisco LGBT Center and member of the grant making panel at International Trans Fund. And Aria Saeed, who's the executive director of the Transgender District and also founder of Queen Culture Initiative. And finally, Amy Whalen, who's senior staff attorney at the National Center for Lesbian Rights. Welcome, everyone. So I think, when we popped on Zoom and we saw each other's faces, we were all so excited to see each other. And I really want to hold on to that moment. I think it's good if we just kind of go around and check in with each other. And very quickly, just to, toss out there, what are some of your thoughts right now? Kind of what are you feeling right now? It's been a pretty wild 2 weeks. We'll begin with Amy.
Great. Hi, everybody. Thanks so much for having me here and for having this event. It's such a great way to see people who we miss so much on a daily basis. How am I feeling? I think I really agree with you, Michelle. This has been a bit of a crazy time with the pandemic and with this crazy political climate. And I'll just focus on the last couple of weeks where I have felt really hopeful and really relieved and really energized by what's happening and the work that we still have to do. And so I'm excited to be here with all of you here and to continue this, important work on behalf of LGBT people and their families.
Maseo.
I've been feeling energized and just incredibly inspired. I think it's been incredibly inspiring to see the grassroots movements sort of take a hold and, being able to steer things in a new direction and know that we can build power. And to also see, I've been thinking about what our movement looked like 20 years ago versus now. And to sort of just think, for me, to think about what I thought was possible 20 years ago versus what I know is happening on the ground in communities all across the country is so incredible, to see the progress. And so I'm excited to see us being able to just move more quickly and being able to do so much more moving forward. So,
Nikki.
Well, I'm on the same page with Maseo. I feel very inspired right now. Also, I feel kind of there's this acceleration going on inside of me because it's just been, for me who works in the healthcare area, around HIV and around our trans communities, it's sometimes translating it to them, to the people that we serve, what is going on is sometimes difficult, especially when you hear from Trump, but now we kind of we feel good, we feel good in talking to our clients now and letting them know that, hey, we're on the go, let's accelerate this, so kind of excited.
Sasha.
I want to say first that I'm really excited to be on this panel and see so many friends, and nice to meet you, Michelle, and thanks for hosting this. And, I do want to say that I've looked up to all of you ever since I was a baby trans person. So it's really neat to be part of this this conversation. I think for me, what I'm feeling is it's a little odd in that, we've all been in the trenches, fighting every day for our communities and worrying about the impact of all of these horrific policies. And, it's been a slow burn, to be honest. I'm still it's like right before a shot of adrenaline hits. And I know it's going to hit because I can feel the excitement building, in my body almost daily, and I feel like I'm on the cusp of just exploding into the possibilities are endless, so I'm in that transition phase, so I'm really excited to see what's gonna come in the next few years.
And Aria.
Sorry, I was trying to find the Facebook Live to get folks to tune in, but I am feeling the last few months for me, surprisingly, I've been filled with a lot of joy and really trying to learn how to maximize my own personal joy when everything around feels like the sky is falling. And so I'm really grateful. I just celebrated my 31st birthday on November 7th and, woke up to the news that President-elect Biden and Vice President-elect Harris will be our president and vice president, and just a renewed faith in our people, and by our people I mean the American people, and just hope that that we're one step closer towards the liberation of trans folks.
I love that. I love that. Thank you. Thank you all. And if you're joining us live and you have questions or comments for our panel, please send them through and we'll get them to the person you want to ask a question. So let's begin with Sasha. You've been working on trans rights on the national and federal level for a long time, first at Transgender Law Center and now at Lambda Legal, the oldest legal LGBT rights organization. How did your work shift from working, through the Obama administration to the current administration? I love this question.
Yeah, well, to be clear, when I was at Transgender Law Center, I did do some federal work. I worked with Amy and some other folks, in working with some of the agencies. And, we saw some positive things moving forward for sure, especially with like the Equal Employment Opportunity Commission. But I mostly worked on state-based policy stuff. I worked with ARIA on a bill that was really exciting, and some different, exciting stuff that happened in California. But I always knew that I wanted to get more involved with federal policy work. It always attracted me. And then after the election, and one of the first things the Trump administration did was to rescind the trans student guidance. I just became infuriated. I'm an ex-Marine, and I just wanted to be part of the fight. So as much as I love Transgender Law Center and still do, I just wanted to be here and doing this work and be able to punch back directly as hard as I can, against some of the attacks that I knew were coming, so be careful what you ask for, because sometimes you get it, so I came out here to be part of that. And it's been rough. The landscape is, obviously, as everybody knows, changed significantly. And I think some of the one of the things that has opened my eyes in doing this work is how much an executive branch can do. I kind of knew this before, but I didn't really know it, and now I do. So regardless of what happens in Georgia, we're going to win in Georgia. But for some reason, if we don't, and even if we do, there is so much that can be done on the executive level. Whether it's executive orders or my daily work involves often working on judges, and the courts have been infected with judge after judge who has a clear bias towards LGBTQ people. We have a report that we put out at the end of every year, and about 1 out of every 3 appellate judges has, a clear demonstrated history of animus targeted towards the LGBTQ community. And that's something, these are lifetime positions on the federal judiciary. And that's something we're going to live with, well beyond, the next 4 years, the next 10 years, for the next 40 years. So, one of the things that's really important, is that we continue to press a Biden administration to appoint judges that are going to be fair-minded and be able to interpret the law fairly, and that reflect our community. There was not one African-American judge that was nominated by the Trump administration to sit on the appellate courts in the entire 4 years. And they've confirmed over 50 appellate judges. So, we have to be advancing early and often, and we have to continue. I think in prior administrations, for whatever reason, we just haven't on the progressive wing, we just haven't prioritized judges and courts as much as I personally feel like we should, and especially after witnessing what I've witnessed over the last 4 years. It's really important that be a really high priority in whatever we do. Another piece of my work is, working on a lot of the regulatory attacks that we've seen. And some of them are high profile. I think people are probably familiar with the 1557 rule, the rule that seeks to carve out LGBT people from the Affordable Care Act, and the HUD shelter rule that is trying to, give shelters the ability to gender police transgender people as they come into the shelter. All those things are going to get challenged in litigation, and they're high profile things that people have probably seen in the news. But there's a lot of stuff under that isn't as high profile, that is causing as much damage, if not more, to the LGBTQ community. So I think it's really important that that we roll those back, whether it's data collection or grant funding, that would strip protections for people trying to access programs that are funded by the Health and Human Services Agency. There's just a whole range of things that we have to clean up, when we think about moving forward with the Biden administration. But it's also important to think about moving forward. That's the status quo, is moving us back to the Obama era. But they were, and Amy and Tina, Amy and Nikki and Maceo and everybody on this call can testify, because we've all been around long enough. They were fairly conservative in some of their positions. We really tried to push them hard on being more inclusive with sexual orientation, for example, in some of the policies that we have, and they were very hesitant. So I think it's really important, especially in light of Bostock and some of the other case law that Amy and others have worked so hard to develop over the last 4 years, that we continue to make sure that we push forward further than just the status quo from the Obama era. And the last thing I'll just say is the importance of data collection. This is something that the Trump administration homed in on really quickly, and made it a priority to eliminate data collection for LGBT people, because they understand the value of that data collection. And it's so important that we, in my opinion, that we make that a priority early, because it takes time for that information to come in and that infrastructure to get created. And unfortunately, I think what happened, one of the lessons that I've learned in this is that a lot of the rulemaking that happened in the Obama era happened in the last couple of years. So it was easier in some ways to sweep some of that away, because it wasn't entrenched in the government. So that's another lesson learned. So I'll stop there, but thank you for the question.
Yeah, no, thank you. I think that's a great segue to a question that we had for Aria. We saw this year, at least in 2020, something huge happened when the world woke up in a lot of ways. When George Floyd's murder happened, I feel like a lot of communities came out, for racial justice. And racial justice has been a topic of our community for a very long time. When we think about, those at the forefront of the civil rights movement and every equal rights movement, LGBTQ people have been there, especially though, Black, trans, GNC folks. And so Aria, somebody who, works on creating the visibility of Black trans women, create space that centers around Black trans people, locally, would love to hear your thoughts in terms of holding on to this momentum and in hopes that it isn't just a one-off or that we really get serious about racial justice. Your thoughts?
You're right, Michelle. It has been a really, really intense year, and for so many people, unsettling. Although for many of us who have compounded experiences, like myself as a Black trans woman, this is an experience where I feel like we've seen it time and time again. What I am grateful for is that the pandemic sort of forced us to sit down and to really look out at the world without rose-colored glasses, and people were at home and saw the injustice and responded, and I'm so grateful that happened. Unfortunately, it took seeing video footage of someone being murdered in that way to activate people, but it did activate people nonetheless. I think, racial justice it ebbs and flows in the public discourse. We've seen, with the election results, over 54% of, is it white folks or white women? It was very specific, but basically voted for Trump and, had made a decision that, maybe they're not racist, but they were willing to ignore racism for all the other reasons that they could consider voting someone like that back into office. And so I think we're still in a space where we have to keep having the conversations, as uncomfortable as it makes people, that these conversations still have to be had, because, justice has not been served, especially when we see the magnitude of violence that our community, as a trans community, faces, and not just capital violence. Like we experience microaggressions and day-to-day violence, from people staring at us to gawking at us, harassing us, misgendering us. Like those are all forms of violence against trans people, but very specifically seeing that there is a genocide impacting trans people, and very specifically Black trans women. And I feel like we dance around it without talking about how we are being murdered at the hands of cisgender men, and how race also plays a portion in it, and it gets dismissed out of the conversation. And so I think, again, having the uncomfortable conversations to get true to power is what's going to have us fully shift in the coming years, hopefully.
We're already starting to get some questions from our audience. Thank you so much, and keep sending them. Picking up from where you left off, Aria, what would be your top or 3 priorities that you would like to see taken up by the Biden administration in the next 4 years? If you'd like to answer that, Aria, before we ask someone else from the panel.
What is my top 3 priorities for Biden-Harris and their administration for trans folks? Oh gosh, I mean, it has to be aligned to our dream of building trans futures in which we are thriving, and that we are included in society. I think, President Biden, in his address of accepting the Electoral College win, did utter the word transgender, and everyone's like, and I'm like, that's amazing, and that is not enough. We have to see, I think, policies that are protecting and being very intentional about protecting transgender people when it comes to our healthcare as a policy issue, that we have equitable access to that healthcare. I think really working with these federal departments to address and pull allocations of funding together to address the marginalization and disenfranchisement that are very, very small population. We're a very small population in America. We make up less than 1% of the population, and yet we experience the brunt of oppression in many ways, from unemployment, lack of housing, and it's not that we're not applying. We're not even given the chance to be in the room. And so I think these federal departments are going to have to be very intentional funding wise and collaborating with transgender thought leaders across the country, and how this administration could be addressing the epidemics that we do face day to day. And then finally addressing violence. Like, this is the deadliest year on record for us, as long as we've documented the lives of trans people being taken away from us, either naturally or through murder. This is the deadliest year. The list is almost 40 trans people. And so this administration has to do more than just say the word LGBT. They have to do more than just say the word transgender. There needs to be a lot more dialogue and centering of our community when it comes to their LGBT affairs.
Nikki, would you like to also add to that? Maybe your, some top priorities, a wish list for the Biden administration?
Are you asking me? Oh,
yeah.
I'm on board with Aria. Working in the healthcare field is that, a lot of trans folks really still experience discrimination in healthcare, in getting accessing healthcare. And at the same time, we are very lucky here in San Francisco, because we have Gender Health SF who assist our trans siblings in terms of getting their surgeries done and necessary surgeries. But there's still a lot of folks out there who still needs assistance, So, we need to, I would love to see this new administration to really, walk the walk if they're going to say, and work with us in terms of all aspects, and having us in the room, as Arya said, because most of the time we're not there. They're making decisions for us, and that's the sad part of this. They're making decisions for folks who they don't even have the experience that we have, that we go through. So I think that would be my wish.
Thank you. We have another question from the audience, and I think this question is good for Maceo. Being that you work in the Office of Transgender Initiatives in the mayor's office, but with more trans candidates getting elected to office across the country, are they proposing and passing pro-trans legislation, or are there still not enough of them? I think your perspective in being close to elected leaders, especially here in the Bay Area with many of our community members, being successful in their campaigns, you might have some thoughts around that. Maceo?
I mean, I don't feel like there can be ever enough trans people. That's my question. Anywhere. It's been really incredible to see so many trans elected officials or trans people get elected into office. That's really a beautiful thing to see. And I want to push our community. One of the things that I have noticed too, with all the really amazing trans folks getting elected to office, is that it was also really white field. And so how do we also uplift trans folks of color, Black trans people, Latinx trans people, Indigenous trans people into offices as well? I think that's really incredibly important. Especially if we really do want to center issues that are intersecting around racism and transness and around low-income issues, wanting to have people in office that have experienced those things and are part of those communities. And I think as someone who is serving in local government, I think one of the things that's so important about us being around is being at the table, right? And being able to say and work on specific policies and work on specific programs and work on specific issues that affect our community. Because oftentimes, not always, but so many cis people don't necessarily sometimes are too uncomfortable to say the word transgender, ranging from that to being flat out transphobic and thinking that we shouldn't exist and trying to erase us from policies, to just also not knowing that we are alive or that we have specific issues, or that we're falling through the cracks, or that we're not getting employed. And so, we just need more people at the table, whether that is in elected offices or serving in government, as city officials, as county officials, and on commissions, and in all kinds of ways. I think we definitely need always more representation. And as we have that, we've been able to push more work forward. I think as we've seen our representation multiply over time and over movement, we have seen that we have pushed things forward and have made changes, although we still have so much more to go. So.
Absolutely. Well, there is the LGBTQ mainstream media calls it a rainbow wave, but it's not really a rainbow wave, because we should talk about the colors of trans GNC folks. But we're seeing more gender nonconforming folks being elected to office, as well as trans, especially in this election. The next question is for Amy, of course. Sasha had brought up the Supreme Court, and we had talked about a SCOTUS decision that was huge for our community and employment rights. You're working on a case right now representing Artie Edmo, but this is a big question for you in talking about the new SCOTUS appointments, including Justice Barrett, and then through the President Trump's administration also appointed someone like Justice Gorsuch and Justice Kavanaugh. I almost forgot his name. Maybe I want to. But how do you see the new SCOTUS appointment impacting the future of the movement, especially, working on a case like you are right now with the National Center for Lesbian Rights?
Yeah, I really agree with what Sasha said earlier, that it's certainly true for the U.S. Supreme Court with these three appointments that the Trump administration has, done during his term. But it's also true in the lower courts. It's true in the district courts and the federal appellate courts. And, being a civil rights lawyer for the last 20 years, it's, it's hard to think about how is my life going to change? How are our lives going to change on a day-to-day basis when we're dealing with this change in the federal judiciary? But, I think that there's so much that can be done at every level. And that is true in state courts. It's true with grassroots organizing. It's true with the amazing work of activists like some of the people who are on this panel tonight. I mean, there's just so much progress that has been made and so much amazing work that's being done that I think, we can only move forward. We will only move forward. There's a certain amount of progress that a social justice movement makes where it becomes incredibly difficult to really turn back time. And certainly the Trump administration has tried with all of its might to attack us and to pass policies that have been, not just really dangerous, but really scary to our community for the last 4 years. And I think, there's a bit of a sigh of relief that at least that moment is over. But there's also a recognition, like Aria has said, and Nikki, and Sasha, and everybody on this panel, that there's, a lot of great work being done. So I'll talk briefly about this case. We represent Adri Edmo. She's a Native American transgender prisoner housed in the Idaho Department of Corrections. For most of her prison term, she was housed in men's facilities, which is a very, very common practice in prisons and jails throughout this country. And she has been repeatedly punished and targeted for expressing her gender identity and denied basic health care. So one of the biggest issues she faced was that the prison denied her affirming surgery despite her desperate need for it, including being driven to the point of attempting self-surgery. So 4 months ago, after years of litigation where the Department of Corrections in Idaho attempted to take it all the way to the US Supreme Court, 4 months ago, Adri had her surgery, and we were able, through some last minute emergency motions, to even ensure that she had it during the pandemic. And so, this just goes to show you it's an example. This was litigated in a very conservative state of Idaho, and we were still able to prevail in this case because we have we have science behind us and medicine, and we have the reality of discrimination behind us. And, prisons and jails are some of the places where transgender people experience the most horrific experiences that you could imagine in this country. And so at NCLR, it's really important for us to, represent clients who really need us, people who are the most marginalized, the most at risk, the least likely to be able to hire their own attorneys. And so that's become a priority of our mission as a legal organization, and, fighting for people everywhere they are, whether that's in their jobs, whether that's transgender kids in schools, whether it's a kid who's, stuck between a custody battle between an affirming parent and a non-affirming parent, representing people getting access to healthcare, both inside prisons and outside. We have a new lawsuit in Arizona challenging a discriminatory Medicaid policy where the Medicaid program in Arizona will not cover chest surgeries for transgender kids. So these are just examples of some of the work that we do in partnership with other people, and that hopefully will slowly but surely improve the daily lives of transgender people around this country.
Sasha, let's pick up from that. I mean, I think I heard you talk about, not being in the defensive and turning to the offensive, hopefully with a Biden administration. We saw the previous, or I'm already jumping the gun and hoping that it's already 2021. I mean, during the Trump administration, a page out of their playbook was either, the president was going to do something dangerous through an executive order, or, as we've been talking about, appointing a lot of conservative judges to the courts. Have we thought about what might be a strategy, for some of these cases, these lawsuits that we're going to have to file on behalf of our community? And if, some of these judges may rule the other way, kind of scary, some stuff coming out of even Justice Alito, not all of a sudden, but definitely recently.
Yeah, and I think Amy touched on this, but I think it's, whenever we do impact litigation, which means that we're trying to, we're working with, one plaintiff or a handful of plaintiffs trying to make a difference for a large number of people. It's always really important to be strategic about deciding where you're going to file a case. There's the Fifth Circuit, for example, is a circuit court that covers Texas, Louisiana, Mississippi. And even before the Trump-Pence administration, it was a pretty tough place to bring a case, and it's gotten way, way worse. So if you're going to bring a federal case trying to make a difference for a large number of people, you don't want to create bad case law precedent. And that's just become, as you just mentioned, a whole lot more difficult. So we have to think a lot harder about where we're filing cases. Sometimes you don't have that luxury. You've got a person in distress, and it's really important that a case be filed on their behalf. But as far as the strategic thinking, we have to think about where we're going to file. And as Amy mentioned, also historically, if you look at the way LGBT groups have done a lot of their litigation, a lot of it was at the state court level. So we can be looking to state courts to advance protections, because the federal judiciary has been so infected. But we can also, again, press the Biden administration to move quickly and continue, to fill vacancies as soon as possible. Again, we just haven't prioritized judges in the way that the right has, and I think it's really important that we as a community and advocacy community make sure that that's on the top of mind, because, time goes by really quickly. And, I know that we have all these other priorities, but until we start leveling the playing field in some of these different circuits and in some of the federal courts, it's going to be tough. What's the tough row to hoe, or whatever the saying is. So yeah, I think that we just have to think strategically. I think in addition to what Amy mentioned already too, there's a whole lot of room, and Aria mentioned, there's so much room for what really gets me going as an advocate is doing creative, positive, progressive policy work. And we've done a lot of that in California, and we should be thinking strategically in other places where we can move explicit protections forward. Ideally we'll have the Equality Act sometime soon, but in lieu of that, we can do a whole lot of good on the state level, that beyond just non-discrimination protections are really, really important. But in California, for example, just this last session, there was a law passed that requires going forward that trans prisoners be housed consistent with their gender identity. And that shouldn't be unusual. That should be something that's the standard. And it's so dangerous to be housing people that don't want to be housed, inconsistently with their gender identity. It just creates a really dangerous situation for them, and it's an absolute failure to protect them. So I think that that's something we should be thinking about, more aggressively and proactively across the country, in addition to the other strategies.
Thank you so much. We have another question from the audience. This question is for Nikki and Aria. What can LGBTQIAAP nonprofits do differently to be more supportive of trans people? We'll begin with Nikki.
Well, I think it's so important to have allies around, because they'll be there when you need them, but I think there's a lot of things that they can do. I mean, just supporting, for example, there's so many organizations now that are trans-led, so I think they should collaborate with this organization and support and uplift them for their projects, for their programs, and just be, see how and support trans leadership, and also at the same time, there's opportunities to invest for leadership, in the transgender community. One thing that I always advocate for is leadership development in the transgender community, because, for example, someone like me who's been around for almost 25 years in the HIV field, I'm kind of tired already. I need to pass on the baton and make sure that other folks can continue the work that I've done. So I think there are so many opportunities that LGBTs can really just be part of if they if they hone it in accordingly to what is needed in the trans community. So,
Aria?
I agree with Nikki. I think it's such a tricky time in this particular moment for a lot of nonprofits, especially LGBT nonprofits, to really sort of be sustainable. But I will say for LGBT nonprofit projects that are pretty large in terms of funding and what have you, I do have a couple things that that my project does, the Transgender District, that I think is important in ensuring that your organizations staff-wise are centering and thinking of the possibilities of trans people being staff. And one of those things is really removing education requirements for positions that are not, like if you're a lawyer, then obviously you'd need the skills for that. But if it's not super specific, then, you know, I don't have a college degree and my work is high impact and national now. So there's no barometer to determine whether a degree is going to ensure success in a role. I think it really is just about, you know, supporting your folks. Equitable salaries. You know, you should be paying trans folks as top talent. I firmly believe this. Even if someone is entry level, they're probably going to take on additional things along the way that require certain emotional labor. And they should be compensated for that. They shouldn't be struggling, you know, 2 days before payday trying to figure out how to get to work. And then you have them, you know, on the bathroom committee to turn the bathrooms to all gender restrooms. Like, no, and that's not their job. Like, so equitable salaries are ideal. And I think also expanding health coverage. I think a lot of organizations can actually pursue like the PPO healthcare benefits and sponsor it at 90%, so that trans people have more autonomy and picking how they're getting their medical care, and what options they have. Like, it's not enough to, I mean, we all love Kaiser, but it's not enough to just be like, here you go. And it's like the bare bones plan where the copay is like $70. Like that doesn't promote success and morale for your folks. And acknowledging that trans folks are going to need a little more time in the first few months of being hired to get things taken care of that an average cis person in a role probably won't need. Just my thoughts.
I was going to say both of your thoughts. Wow, that's so good. Thank you. This question is from the audience and it's for Maceo. Why is in all the county and the city of San Francisco, there is no specific program or resources for an older trans person, specifically in the trans Latinx monolingual immigrant community?
Yeah, I mean, I think that's hard. We have a good amount of resources. However, like specifically monolingual Spanish speaking resources for trans elders, that's possibly a gap, right? Like that needs to be filled. We have really incredible, wonderful organizations like ELA para Trans Latinas and Chicas at Instituto para la Raza, Familiar para la Raza. They have programs for Trans Latinas that are monolingual speaking, but maybe it's not elder specific, and there are elder specific issues that do come up. An Open House and Kerr Senior Center, and I believe also SF Community Health Centers working on it as well, have programs for trans elders specifically, which is really important and really incredibly wonderful that we've been able to develop those programs. And yeah, I mean, I think that's a really great question. Like, how do we make sure that we can support monolingual Spanish speakers or monolingual speakers of different languages in those programs as well? And I think one thing that I was thinking about too, with this sort of the statewide wins or in general about representation, is also about like the power of the grassroots movement. We've seen that in the presidential election. And I want to also go back to that goes both like on a local level and on a federal level and on a statewide level. So I think it takes people asking questions like these to people like me, to the board of supervisors, to say like, hey, this is a need that we have that we need to fill and figure out a way to serve our community. And I want to continue to encourage people to ask those questions to the board of supervisors and to us. And I also want to like encourage people to do that at the statewide level. One thing I also want to bring up was that the Invest in Trans Lives Coalition that was led by the Trans Latina Coalition this year did something, again, like 20 years ago, I would have never imagined was possible. And they went to the state of California and they said, hey, we are experiencing tremendous health disparities in trans and gender conforming communities. And we need to have that addressed. And California, you need to like set up a fund to make sure that trans-led organizations are receiving the funding that we deserve in order to serve our communities and make sure that our wellness is prioritized. And like that was sort of like, it was seen as a long shot. And the organizing that happened around that, the grassroots organizing around calling the state legislature, getting people involved on social media, and calling out their state legislators out on social media and saying, hey, we need this. We passed it. We passed the country's first ever specific state fund for trans wellness. And that's huge, and that's creative, and that was a bold and risky move, and we got it. It was a victory. And so I think I just want to encourage people to continue to ask those kind of questions, continue to get involved. And I think similarly on a local level, right? People kept saying we need actually more resources for housing subsidies. So we increased the funding in housing subsidies. Lyon Martin came and said, have a Save Lyon Martin campaign, and said we need funding to make sure that it stays. This is the one place that trans people go to see healthcare, mental health services. And, going to the Board of Supervisors and making that campaign has really paid off, because it makes the Board of Supervisors say, right, this is a need that we need to invest in. And so I think for me, my passion has always been in grassroots organizing and building power, and always continuing to encourage people to do that.
Well, that's a great segue, for us to talk about. We've been talking a whole lot about the federal level and kind of our wishes for this new administration that's incoming for the 2021 year. What about locally? What are some of your hopes, or what you think we should focus on, as far as trans policies and continuing progress? Amy.
NCLR is a national organization, so we're very looped into the local community in San Francisco as well, and have partners here. But it's not our focus as much, except that we do work on California legislation. And so, I think, but I have lots of opinions about this issue. And I think that a lot of the work and the policies that have to be worked on federally also apply to the localities and to states. And so, of course, like you said, Michelle, there are immediate things we need to do on the federal level that will affect transgender people across the country. And that includes immediately undoing the anti-trans policies of the Trump administration. But NCLR has a partnership with Santa Clara County aimed at keeping LGBTQ kids out of the child welfare and criminal systems. It's called Support Out, and it takes a public health approach to youth well-being. And the objective is to sort of transform those systems to ensure that there's a strong safety net for low-income LGBTQ kids of color and their families. We also locally here have, NCLR has a immigration and asylum project where we provide direct services to people who are seeking asylum in this country because of persecution in their home countries, or who are having immigration related issues. So we have those deep ties to our local community here. We have our conversion therapy campaign called Born Perfect, where we have worked in localities around the country to pass laws that ban the practice of conversion therapy on related to sexual orientation or gender identity from licensed therapists. And so those bills ban licensed therapists from practicing conversion therapy on kids. And I think that we really look at our work through a poverty lens. So Tyrone Hanley, who is our senior policy counsel in Washington, D.C., he leads up our work, which is part of a LGBTQ anti-poverty network. And that's basically a collaboration of more than 100 national, state, and local organizations around the country that work in the LGBTQ anti-poverty and anti-hunger movements. And so, especially as a result of this pandemic and the health challenges that have resulted and the issues with our economy, this work is more important than ever. We just helped to create a transition memo for the Biden administration, which is focused on, the things that we want that administration to do in the first 100 days of office. So, this kind of question, I could go on forever, but those are just a couple of examples of things that I think are deeply important to our community and, is work that we're going to have in this coming year for sure.
Anyone else want to add to that? Anything you think we need to focus on locally?
Yeah. So I think with the pandemic, I don't know if it's a policy issue locally so much as just an abrasive reality, which is that we are in a moment that is worse economically than the Great Depression. And I feel like everyone dances around it, but, so many people are awaiting unemployment. So many, that law just passed that made it so that fringe workers, folks who are independent contractors are, like Uber drivers, Lyft drivers, et cetera, or food couriers, what have you, and the limitations that has in terms of safety nets for things like when a pandemic happens. How many sex workers do we know can call up the unemployment line and get benefits or to get some sort of reprieve? And so there has to definitely be more mutual aid funds to come out again, especially with the surge of cases of COVID during this time. I also think investing in trans futures, that's like the word of the day for me, but something the Transgender District is doing is we're launching our Entrepreneurship Accelerator program. And we have partnered with the Black Lives Matter Global Network and Long-Term Stock Exchange to make this a possibility. And our cohort of 10 trans folks will exit with a full sort of ready to go business plan, and they'll have their tax filings, they'll be a licensed business, they'll have their website running, they'll have their branding, and we're giving them seed grants. And I think, I think we have to, it's very important to me that we move away from just trying to train folks to get jobs at McDonald's and then McDonald's won't hire them. If McDonald's won't hire us or people won't hire us, then we got to create the shit ourselves. And then we can hire each other, excuse my language, sorry. But then we can hire our people. That's what we're asking every entrepreneur who enters this program, that we're giving them a grant, not a loan, to start their business. And the only requirement is that if they become lucrative, that they make a promise and a commitment to the trans district that they'll reach back and hire other trans folks as much as possible. And I feel like that is what's going to really shift the tides of the disparities that a lot of our community is facing. And we have to invest in that. And unfortunately, for philanthropy and other institutions, it's not attractive to donate to an idea in that way or to invest in that kind of idea. But we have to invest in our futures as much as we do in responding to the violence that we endure from our government, local, state, and federal, and when it comes to policy as well.
Aria for president. Well, I can't believe it, but we've already spent almost an hour. And so I've got one last question for you before we bring Claire back on to say goodbye to everyone. And, just as much as there's a lot of work to do locally or statewide, there is a lot of work to do federally. And so just very quickly, we'll go around here. I think all of you should be serving in the Biden administration if you've not already been tapped to do so. But if he were to come and ask you to join his cabinet or some position in his administration, which would it be? What role do you think would be good for you? We'll start with Nikki.
Well, that's a broad selection there. I think for me, I'll stick to what I know and what I've come to is to maybe be part of the Biden's response to HIV and AIDS. Because this is still something that we need to address, especially in the trans community. Trans women are the highest, rates of HIV infection here in the country in terms of when you really just have to do sex work and you can't do anything, those things. So they get infected or 49 times likely to be infected with HIV, trans women. So I would like to be in that department and really, look into what do you call it? The policies in prisons, for trans women who are living with HIV, and see what we can do to correct what is not, criminalization, HIV criminalization, those things. I love those things. So
it's perfect. Sasha.
This is kind of a nerdy answer, but there's an agency called the Office of Management and Budget that works with all the different agencies, and it's kind of like the rules go to them and they get to have input about them. And one thing I'm worried about is that because the courts have been so infected by these right-wing judges that unless these rules are done the way they should be done, and every I is dotted and every T is crossed, that they're likely to get challenged, in court. And plus it'll give, some ability to have some input on the different rulemaking that happens from the different agencies. If not that, the Veterans Administration, I'm a veteran, so that'd be the other piece.
And I love that nerdy position. Somebody's got to do it, and you'd be perfect. Maceo.
Hi. In some ways, it would be really amazing, right, if the Biden and Harris administration had an Office of Trans Initiatives, right? Like an office that actually looks at trans issues systemically across departments, and also are responsible in making sure that we get trans people in all of the departments as well. So like supporting the administration, finding trans people that we can appoint to lots of different positions all across all of the departments, and look at sort of the big issues systemically and how we can tackle them.
Absolutely. Amy, Attorney General?
Oh my God. I think I'm not qualified for anything, but I think it would be fun to be part of the transition team, because I think, I hope that the Biden-Harris administration will remember the first 4 years of Obama and how they moved very slowly. And I think it's really essential that the Biden-Harris administration move quickly and, undo immediately the anti-trans policies of the Trump administration, end contracts with private prisons, address poverty issues, and decriminalize sex work to the extent that they can do that on the federal level or have enticements to do that. I think figuring out ways to address the toxic culture of sexism and racism that has led to extreme violence against the trans community and Black and brown trans women in particular, making sure that anti-discrimination laws are being enforced in employment, in housing, prisons and jails, the healthcare system. So, I think I would want to be part of the initial push of undoing the harm that has been happening for these past 4 years and trying to get us back on course.
Amazing. And I don't know what you mean by saying you're not qualified for all that. We need lots of you, I think, in the part of the transition. Hopefully that's the case. Last but not least, Aria.
Okay, well, I first thought, I guess I would want to be Olivia Pope. LOL, if people watch Scandal, then they'll know. But fun fact about me, I actually, I did an internship when I was 16, 17 for Bank of America, and we had to do etiquette trainings from the chief of etiquette at the White House, in the White House. And so years ago, anyways, her name was Becky Pitts. I wonder if she's still alive. But anyways, I would love to be like an etiquette officer, which has nothing to do with like trans policy or cultural districts or trans districts or anything. But I don't know. That's probably why they wouldn't even pick me, because I would want the etiquette officer job. LOL.
No, I think they absolutely need you, and you'd be great, just to help First Lady, First Woman, Jill Biden, maybe, even implement those changes at the White House. And Sasha has actually put in our chat that there's a link for applicants on the Biden-Harris website. So I would love to see all of you, and I'd be so incredibly proud that you're representing us. Well, that's the end of our program, and thank you so much for your expertise and your insights. We'll bring Claire back, who's with the Office of Transgender Initiatives, and help put all of this together with our incredible partners. Claire.
Thanks so much, Michelle. What a great conversation, and I loved your closing question. So many incredible answers.
Absolutely, and thank you for helping us put all of this together. Any last thanks and shout outs out there for us before we close the program?
Yeah, I just wanted to give a reminder to please visit our website, which we linked in the chat, for all the additional events that are happening throughout the rest of the month. And wanted to highlight Nikki's work for Trans Day of Remembrance that takes place on Friday, November 20th. And there'll be a virtual ceremony to honor those that we've lost to violence, as well as they're hosting Transgiving the week after, and folks can stop by and pick up food and resources. And so just really using this time as how we can give back to one another and really remember both trans awareness, but how we can take the next step into action. And so many great insights from the panels, both panels tonight, around how we can do that work moving forward. So thank you so much, and really looking forward to the work ahead together.
And thank you to all our incredible experts, our panelists. Love all the work that you do. Please support the work that our advocates do. It's so important. And thank you for joining us for Trans Awareness Month, and also the Commonwealth Club for providing the platform for these important discussions. If you'd like to see more programs or hear more of what's coming up, head to commonwealthclub.org/MMS. Have a great night. We'll see you next time.